Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist from Houston, Texas. Today, I want to talk to you about cataract surgery, a personal experience, a personal journey. So, I can share with you some of the things that I learned and some of the things I would do differently. The feature presentation is going to be cataract surgery, a personal experience and lessons learned by Dr. Nik Nikam, that is myself. I'm going to go through a series of 8 to 9 steps to walk you through the process of finding out that you need a cataract surgery, finding the doctor, and what are all the things that you need to be aware of before you go for the cataract surgery, during surgery, and afterwards. The first question is, what is the best time for cataract surgery? I knew my vision was getting worse a couple of years ago. Because of the COVID Delta wave, Omicron wave, and all this, somehow I had to keep just postponing this. And finally, towards the end of 2021, I decided to see my eye doctor, whom I had been seeing for more than 20 years. But I was not the only one who was smart enough, because there were 100 other people who were standing in line right after this Omicron wave came down to see the eye doctor. As a result, my appointment was set up for like March 2022. That's 3 months after I went to set up the appointment to see the eye doctor. And that's how busy the doctor was. Let's talk about the side effects of delaying cataract surgery. As I told you, I was told I needed cataract surgery about 2 years ago. I was told I had grade 3 cataract in my right eye and grade 2 in my left eye. I did not realize some of the side effects that I had for the past 12 months or 18 months because of continued deterioration in my vision. Because I spend 10 to 12 hours on the computer, because I work on the internet and on medical patients, most of my work is close vision. As a result, the cataract was seriously interfering with my vision. Not only in terms of looking at the screen and doing what I'm supposed to do, but because I was straining myself, that was giving me severe neck tension, pain, headaches, and also it kept raising my blood pressure because I was constantly struggling to focus my eyes. So the best timing for surgery is when your doctor says it's time for you to get the cataract surgery, because there are going to be side effects from delayed surgery, especially if you're working in an environment like myself. If you're a computer expert, if you are dealing with computers, and if you're doing close-up work like handicrafts, then you need your clear near vision as perfect as possible. That's one important lesson I learned. That is, if you need a surgery, you better go see the doctor and let them make the decision as when the surgery has to be done. That is step number 1. Step number 2, when you go and talk to the eye doctor, things get more complex than what we think it is supposed to be. We have heard about people having cataract surgery camps in India where they operate on hundreds of thousands of patients every year in just tents, and they all get better. But of course, we live here in the United States. So when I went to see my eye doctor and I said I needed to set up for the cataract surgery, he said, well, that's fine. I think you have grade 4 cataract in your right eye. I think that's what we need to focus upon first. And a week or two later, we can work on the right eye, which is grade 3. I was perfectly willing to go with the eye doctor's recommendation. Then they threw in a little curve there. They said, either you can have a regular surgery or you can have a laser-assisted surgery. I'm a cardiologist. I tell them what they need and what are the alternatives. I don't have them make a medical decision as what kind of stent they need. But anyway, getting back to this laser-assisted surgery. So I had to talk to a lot of my friends, eye doctors, professionals, indirectly, I should say, through my friend, and also look at a lot of videos on YouTube to determine, do I need the laser assisted surgery? What I found out was being a medical doctor and being a research oriented person, I found out cataract laser assisted surgery has three major advantages. Number one, it is the precision of the cut the laser can do compared to a blade used by the surgeon's hand. Number two, it can also make micro incisions. You can follow my green arrow here. Micro incisions in the cornea, so the scar is going to be less and trauma is going to be less. And number three, the laser can break these hard cataract contents. As a result, it is easier to take them out, because in a regular eye surgery, they break it with the ultrasound and then suction all the broken pieces. So these were the three main advantages. And after talking to several friends who had surgery and talking to other eye doctors indirectly, I decided I was going to go with the regular surgery. So that was my decision. And the other advantage of using laser is if you have an astigmatism, that can also be corrected using, but I don't know if they do astigmatism correction at the same time they put in the lens. That's a different story. You have to talk to your eye doctor to see if that is feasible. The next thing is, do you want a monofocal lens or a multifocal lens? Why are you asking me all these questions? You know, I am not an eye doctor, I'm not an eye specialist, but I mean, this was a very valid question, because this is something that's going to determine how we vision ourselves after the surgery. There are people who say, I don't want to have any eyeglasses whatsoever. And if that is your main aim, you can go for the multifocal lenses. That is, it will help you to focus in the immediate close-up vision like computers, iPads, cell phones, the intermediate one like you're looking at the grocery store labels, and the distant one, of course, if you're driving on the freeway. That's the purpose of the multifocal lens. Multifocal lens, what they do is they make curvatures in the back of the lens lines that will help the lens to do trifocal function, just like the variable eyeglasses which I'm in fact wearing right now, which has distant intermediate vision correction, but I don't need a close-up vision. I mean, that was before I developed the cataract. So what is the function of the monofocal? I'm sorry, it should be monofocal, it's not monogonal. The monofocal lens is like, as it says, it just focuses at one fixed distance. In my case, the eye examination was done, and we determined my computer monitor, which is my main purpose, is approximately 16 to 18 inches from where I sit in order to have a clear vision. So that measurement was taken and determination was made to use the monofocal lens. I decided to go with the monofocal lens for several reasons. Number one, I have been using eyeglasses, the same eyeglasses, for 40 plus years. I have no problem wearing glasses. I love to wear glasses. I think I look much older with the glasses, to say. I don't know. How do I look without glasses? I know it kind of looks bland to me. So I look a little more sort of professional with eyeglasses. Anyway, that's besides the point. Number one is, of course, I have been used to wearing glasses. I have no problem wearing glasses. Number two is what you're seeing in this picture. When you use multifocal lens, it has a tendency to create halos around the lights, like traffic lights or car lights, especially in the night. Please pay attention. It causes halo, and this is a oncoming traffic on the left-hand side. Please look at my green arrow here and look at the way the lights look if you have multifocal lens. And everything kind of looks fuzzy. And also because of the dull lighting, because your multifocal lens can make these images look duller compared to having a trifocal lens where it looks a little bit sharper But if you are having a monofocal lens, it would look exactly like it is supposed to be. Of course, with a monofocal lens, you're not going to be able to focus this intermediate distance, which is like the dashboard and the radio and the street map panel. For that, I didn't care because I'm already wearing intermediate and distant vision glasses. Practically, I could use the same glasses with some minor changes after I get my cataract surgery. So I decided to go with monofocal length. It is up to you and your doctor to decide which is the best lens to go with. Medicare pays for the monofocal lens. Please pardon the spelling here. Whereas multifocal lens can vary anywhere from $2,200 to $2,500. So that's something you need to keep in mind. There's one more thing I wanted to get back to this laser assisted surgery. I talked about three important factors, and the fourth important, if they use laser, it's going to cost you anywhere from $1,000 to $1,500 depending upon the surgery center or the place where it's being done. So keep that in mind. So it's an extra cost involved when you use laser assisted surgery for the cataract. Let's get back to our track. So I never liked the concept of these halos around the traffic lights from the car, while you're driving at night, because even they say that these halos will get lesser and lesser with time. But when you plant something in my mind, the chances are psychologically I can get it out even if the eye gets better. I mean, that's just me. So that's the reason I decided to go with monofocal length. Now I'm using my regular glasses. Actually, I had my surgery yesterday. If you can see, I have this X mark showing where I was supposed to have the cataract, which side. So that's the extra cost for the multifocal length. All right, how do you find a doctor? Just go to the eye doctor you have been trusting for the last 10, 20 years if you have been wearing glasses, or talk to your friends who had surgery and what their experiences are, and talk to them as what kind of surgery they had, what kind of lenses they had, what kind of recovery time they had, and then you make a logical decision. You had to rely with your primary doctor and close family friends who had experience having gone through this procedure. The next step is the big surgery day. The big surgery day, in my case, I had to wait for more than a year. There was a lot of anxiety and tension. I know I'm a cardiologist. I've been doing hard cats and putting stents and all this, but I tell you, when it comes to your own body, you crumble like cookies under pressure. Anyway, on the surgery day, it's quite obvious to be anxious. But we have to remember that we are going for surgery, and we make sure that we are prepared for surgery. We don't want the surgery to be cancelled. So make sure you're allowed to take all your medications for blood pressure or heart. But don't take your diabetes medicines because you're not going to be eating anything after midnight. Then make sure you carry your ID card and the insurance cards, because when you check in, they want to get a copy of your insurance cards and your ID. And if you don't have it, that's going to delay. And do not carry a whole lot of luggage. Bring a bag and put everything in your bag. Your wallet, your cell phone, and any partial dentures you have. Put all of those in the plastic bag, which they will just put it on the same stretcher, so it's not going too far. Because you don't want to lose your dentures. I have heard numerous stories of people losing their dentures after going for surgery, and they get mad when they lose their dentures or any other prosthesis. Okay, when you're ready to be brought into the preparation room. Now we are in the surgery preparation room. You are placed on a stretcher and you'll be met by the nurse. You'll be met by an anesthesiologist. You'll be met by your eye doctor. And of course, the person who is assisting your eye doctor, the PA or the technician, he may be there. Your doctor is going to come and they're going to mark which eye they're going to be operating on. The nurse is going to mark. The anesthesiologist is going to mark. That is to confirm that they all in agreement with what needs to be done that day for you. And of course, they're going to monitor your EKG, monitor oxygen level, and take your vital signs. They're going to start an IV in your arm or wherever you have a good vein, because that's going to be used for giving medications. Next step is now you are in the operating room. They just roll you into the operating room. You're still on the same stretcher. The pillow has a little like a donut hole where they want you to drop your head back so you can extend your neck so they can clearly see the eye. Then they place sterile covers. I didn't want to see anything. I just closed my eyes and said, please do whatever you have to do, because surgery, you have to trust your doctor like he's God. So they place sterile covers over your face, but you will be conscious during the entire procedure. Of course, you're going to get IV sedation and tranquilizers. That's why we have the anesthesiologists on the side. Next, the actual procedure. Of course, I didn't get to see the whole procedure. All I could see is what I'm going to explain to you. Of course, they covered our face with sterile gowns. And of course, I didn't want to see anything anyway. You don't feel any pain because they put some pain drops, they dilate your pupils, and I saw some flashes of light here and there coming. And then after whatever they did, they said, do you see the red dot? I said, yes. That's all I remember. And in fact, they want us to be conscious, to be able to recognize that dot. That may be an indication that the lens and the retina are talking to each other. They place a little patch over your eyes and say, Dr. Nikam, your procedure is already done. How are you doing? I think I'm doing all right. Now, the post-procedure. As soon as the procedure is over, they are done. Basically, they're going to move you to your wheelchair. They're going to take out the IV. They're going to put this patch on your eye, and they lay on your stretcher, and they will take you to the front door. Make sure your ride is waiting there at the front door when they tell your ride to be there. Then you're off to your home. This patch will be there for 24, 48 hours. Then your doctor will tell you what needs to be done. You may feel foggy from the medications and tranquilizers. That's not unusual. So you may even talk something funny, but that's okay. Tell your ride that you had a tranquilizer. The next day, you are going to be visiting the eye doctor. But before that, when I went for a checkup for measurements and all these things, they gave me a prescription for 3 eye drops. One is an antibiotic, another one is an anti-inflammatory agent, the third one I think is a steroid. Boy, I tell you, these drugs are expensive. 3 of these eye drops, which are like 2 to 3 ml, the list price was close to $750. Let me repeat it again. The list price came to $750. But anyway, with all the discount, which was not covered by my prescription plan, I was able to get it for $260, and they luckily delivered it to my door 3 days before the procedure. So be prepared. You may have to pay quite a bit of money for your eye drops. I also had another procedure called Aura, which is doing like a procedure during the surgery to precisely decide about the lens distance and all this. I don't know what they do, but that was at $350 extra. I didn't mind paying that because I wanted to get the best possible service possible. Okay, so the eye drops are going to be expensive. Not only that, you have to put like 5 to 6 times all these 3 drops, not all of them, together 5 to 6 times a day for several weeks. And it depends upon what your doctor's recommendations are going to be. So be prepared. So there's some homework to be done, and they're going to give you a little calendar with little boxes. You have to check them off. Okay, this morning I had 4 doses of antibiotics. Then I had 1 dose of this anti-inflammatory, 2 doses of anti-inflammatory agent. Whatever the list is given to you, that's what you need to focus upon. And then follow, then how well you can read. I was able to read pretty much 20/30. I thought that was a big difference from where it was the tension in your eyes. After that, they talk about the surgery for the next eye and corrective lenses 4 to 6 weeks after all the procedures are done. And they will answer any other questions you may have. So, ladies and gentlemen, my procedure was yesterday. Around this time, I had just gotten out of the operating room. Today, here I'm sitting and making this video presentation. I'm wearing the same glasses I have been wearing for last 4 years, but they look much more useful now than they were just 1 month ago, a week ago, or 6 months ago. But as I said, I went through a period of increased tension because of all these delays. Number 2, because of progressive worsening of the vision. And number 3, they were giving me symptoms of headache and also increase in blood pressure because of the straining of the eye and the muscles around the eye. So, ladies and gentlemen, this is my story of going through a cataract surgery. From the time I was told about 2 years ago that I needed surgery to the point today I'm sitting here and talking to you, I feel much more relaxed and I am at ease at myself having gone through this procedure. I think the procedure looks kind of intriguing, but actually the whole process is very, very automated, and hopefully you will have a pleasant experience. Thank you so much for watching this long presentation, but I wanted to document this so that it would help other people. Please do subscribe to our YouTube channel. Thank you so much.